Hi, I'm Ashley. I am a doctor of physical therapy. I specialize in treating the pelvic floor and especially with pregnant women and postpartum. So if you're watching this, that means that you have found NayaCare, and I'm so happy that you did because I truly believe that is the best care that you can give yourself. So the purpose of this video is to give you an introduction into what the pelvic floor is and a little bit of anatomy for your own body so that you can start to get to know this area of your body again after having a baby. You have the option of following up with me to get a more individualized consult, and then you can also come see me in my office for a full evaluation, but we'll talk more about that at the end. I want to just start with giving you the background of what the pelvic floor is, why it's so important for us to talk about, and then how you can go about your recovery after having baby. Okay, so here's your pelvis. This is what it looks like from the front. This is what it looks like from the back. And then if you look at it from the bottom, I want you to kind of like look at how you have the circular muscles, right? And then you have this front triangle that comes down and goes back up, okay? So the triangle and then those circular muscles, and then if I flip it back around and show you from the inside, you can kind of see how those muscles fan out, okay? And I'm going to show you a couple more things. So you have your vaginal opening here, your rectal opening is back here. So rectal opening, vaginal opening. Here's your clitoris and your clitoral hood. And then your urethral opening is right in the middle there too. So, so when we think of the pelvis and the pelvic floor, what happened during childbirth, if you had a vaginal delivery, is that all of these muscles lengthened in order to allow for baby to pass through. If you had a belly birth, those muscles were still involved in that process. So even though you didn't have the full opening, you still had changes in those pelvic floor muscles, okay? Where a belly birth is a little bit different than a vaginal delivery is because they had to cut through the muscles of your abdominal wall, so up a little bit higher where your incision is. They had to actually cut through layers of muscle. So that being said, when we talk about pelvic floor and the recovery after childbirth, we can't just look at these muscles, okay? So here's your pelvis, and those muscles sit inside of there. The rest of the deep lower core, or what truly gives you support and what you want to work on recovering after having a baby to protect you in the future, is pelvic floor to diaphragm. So your diaphragm sits inside of your rib cage here. And it's 300, like you'll notice on the inside, the pelvic floor is 360 degrees inside the pelvis, right? Your diaphragm sits inside of your rib cage and it's also 360 degrees. So that means that you have this whole container in your center that is the deep lower core. That's what gives you support. So at the top it's the diaphragm, at the bottom it's the pelvic floor, okay? When you breathe in, air enters your lungs, your diaphragm is sitting here kind of like this, like a dome. So when the air enters, your diaphragm lowers and widens like this. So that pushes down on all of the organs, or when you were pregnant, it also pushed down on the baby. And then what happens is then the last line of defense, all of your organs, and if while you're pregnant, baby is being pushed this way. So your pelvic floor responds by lengthening and opening as well. The opposite happens when you breathe out. So the diaphragm that had lowered and widened because you just took a breath in, now comes back up to that dome shape, and then all of your organs come back up, and your pelvic floor returns to its starting position, okay? So keep in mind that that lengthening and coming back, that's the true power of the pelvic floor. So just like, you know, your bicep, if you curl up here, that's power in the bicep. But if you have a 10-pound weight in your hand and you slowly lower it, that's still using your bicep, right? It's just control versus power. And oftentimes what happens after childbirth is some of the control of the pelvic floor along with the deep lower core. Remember, we can't differentiate, or we can't separate out and only work on one. We have to work on the full deep lower core as we're recovering from childbirth. But it's the control. It's that controlled lengthening under tension that is really going to help you get back to where you were prior to having baby in terms of protecting yourself, having stability through your body. Some of the most common pelvic floor dysfunctions are incontinence, which is any loss of urine that's unintended, or bowel incontinence. So sometimes after birth, for the first week, it can be normal to have a little bit of leaking, but after that, we want to see that go away. So if there's any remaining incontinence, and again, it doesn't have to be a full loss of urine, it can be just a few dribbles. It can be just a few dribbles while you're working out. Any of that is considered incontinence. And that is something that we want to address. You don't need to live like that. Just because you had a baby, whether it's your first baby or if you've had 7 babies, you don't have to live with incontinence. You can jump again, you can run again, you can do everything you did before without leaking. You just have to know how to connect back into that part of your body, okay? The other things that are common after having a baby for pelvic floor dysfunction, constipation, and that comes from everything in your abdominal cavity got moved as baby grew, and then when baby leaves, your body is trying to fill or is trying to recover and fill the space of where baby was. So everything's kind of moving back together, and that can create some fascial restrictions within, which can then create restrictions through your intestines, and then therefore you get some constipation, okay? So a diastasis is also a sign of pelvic floor and that deep lower core dysfunction. So diastasis is a separation of the linea alba, which if you picture a six-pack muscle on a diagram, and you have the 2 sides of the muscle that are red, and then there's usually a white line down the center of those muscles when they're drawn on a picture. That's where the separation comes from. You are supposed to have that separation when about 36 weeks, 100% of pregnancies are going to have some degree of separation. That's so that you have, or that's so baby has room to grow. If we didn't have that separation, there would be no room for baby to grow. Okay, so it's totally normal to have a separation. What's not normal is for that linea alba tissue to not heal and to not support you as you then progress through the rest of your life. So sometimes you'll always notice a little bit more width than what was maybe before, and oftentimes we haven't checked what that separation or what that distance was prior to having a baby, so we don't fully know where your starting point is. But what's really important is to make sure that the depth of that separation improves and that the tissue in between becomes taut and supportive again, okay? Pain with intercourse is also another really common thing after having a child. I just, as a little tidbit, I always recommend that you are the first person to explore this area of your body again before your partner or before another object. And that is so that you teach your body what safe touch is again, that you know what things feel like, what you don't like, because that can be different. Sex is not immediately going to be just like it was prior to baby, and that's okay. Doesn't mean that it's not going to get there, but we just have to know after having baby what makes you feel good, what you don't like, what hurts. So if you're the first person to explore that, you're going to have a much better situation when you do go back to intercourse. So just something to think about. I always recommend using a mirror to look as well. Some women don't want to do that, totally fine, but I always recommend it just so that you can start to get to know that part of your body again. Okay, so when to see me is 6 weeks after having baby. And I truly believe that every woman who has had a baby should see a pelvic floor physical therapist after the birth. And that's because you wouldn't have a traumatic bicep injury again or shoulder injury and not go see somebody to help you rehab it. These muscles and this process that your body goes through, it's a transition for mom, just as much as it's a transition for baby transferring into the world. It's just as much a transition for mom, and there's no reason why you should have to deal with any of these symptoms because there are things that can be done. even if you feel like you're doing really well, that's awesome. I can be there then, or another pelvic floor physical therapist can be there then to help point you in the right direction as you want to get back into getting stronger, or how to best be supported when you're holding your baby and playing with your baby on the floor and all of that stuff. So it's always beneficial to have an evaluation done, just to make sure that everything, like I said, the coordination of the deep lower core, it's very, very rarely just about strength. It's about the coordination of those muscles and the ability for you to connect back into them. And those muscles often just need a little bit of help with the awareness and where they should contract, when they should contract. If you don't know what one side is doing, because that's the other thing too with the pelvic floor, we walk, right? So we have a right and a left side, and usually they're not doing the same things. So if we don't know that, we don't know which side you need to work on what with, okay? So remember that the pelvic floor, I mean, you don't have to know all of the names of these muscles, but the pelvic floor is super supportive if we let it, right? And you can see that it has the triangle on the outside, the circular muscles, and then the muscles that fan out from there. So there's a lot of support that can be had. Again, we just have to know how to connect back into that after having baby, okay? If you tore, if there's any tearing, or if you had an episiotomy, where that's done is here. So if they cut, it's right, they cut from here to here. And if you tear, this is where it is. It might be a little bit off to one side, but this is the area that tears. That area can have scar tissue. We want scar tissue to form because that's how our body heals tissue, but sometimes that scar tissue can cause too much restriction, and so you'll get kind of like a ball, like you get a knot in your back, you can get like a knot in your pelvic floor tissue as well. And so that's one thing that we would look at in an exam as well, so that we make sure that any scar tissue that's been lied down to help you heal is still moving. Otherwise, things like the pain with intercourse, or just lack of function, lack of hip movement, back pain, abdominal pain, so many things can stem from that. So I just can't stress the importance enough of seeing somebody afterwards, or reach out. So if you have questions, reach out and we can do a more personalized consult just to see where you're at, and I can help guide you in the right direction. Last thing, if you're curious right now how to start connecting to your pelvic floor, remember I mentioned how the diaphragm and the pelvic floor, they work together, right? That you get this internal up and down movement, right? As you breathe in and out, you get this movement in diaphragm and pelvic floor. So the best thing you can do for yourself right now is just to breathe, which I know sounds kind of cliche. It sounds like you're not going to be doing much, but honestly, connecting back into that relationship of diaphragm and pelvic floor is going to put you so far ahead of regaining support through deep center, and it's going to help you prevent injury in the future. So as you're breathing in, just think of breathing all the way down into your pelvis. You're trying to send your breath all the way into your pelvis, into your pelvic floor, and then as you breathe out, you're just slowly breathing that air out. So think of it as you breathe in, you're filling your pelvis first with air, and then kind of your abdominal cavity, and then higher up. And then as you breathe out, you're breathing out highest first. So the air leaves here first, it comes into this area last, and it leaves this area first. So you breathe out all the air from your abdominal cavity, and then you breathe out the air from your pelvis. Okay, so slow breaths in, slow breaths out. Thinking of that connection, that internal up and down movement, is the first way you can connect to your pelvic floor, and it's the first thing I always have my clients start with, because if we can get that relationship really strong, then you're going to set yourself up for so much more success in the future with avoiding injury, avoiding incontinence, and all of those things there. So please, again, reach out if you have any questions. You'll have my email, so you can email me and let me know what your specific questions are. If you're curious where you're at, we can set up a more intimate discussion too. Okay? All right. Bye, guys.